Okay. Good morning, everybody. I'd like to open up the meeting of August 19th for the South Sound 911 Board. Roll call.
Board Member Brandstetter. Board Member Bushnell.
Present.
Board Member Casebolt. Board Member Denson. Board Member Holm.
Here.
Online.
Board Member Hubler. Board Member Holsey.
Here.
Board Member King.
Here.
Board Member Mello or alternate Lane, perhaps? Okay. Vice Chair McGilligan.
Here.
And Chair Rumbaugh.
At this time, excused, but she should come online. At this time, any public comment?
None today.
Great. Approval of the agenda. Has everybody had a chance to review the agenda?
Move to approve.
Moved and seconded. All in favor, say aye. Thank you.
Aye.
Next is the consent agenda. At this time, the consent agenda is in the packet. And is there any questions, comments? Seeing none, looking for a motion to approve.
Move to approve consent agenda.
Second.
Moved and seconded. All in favor, say aye. All opposed? Motion passes. We're now on committees and other reports, 988 and 911 co-location update.
And good morning again, Mr. Vice Chair and members of the board. One of the substantive topics that we have on today is a report or information about the 988 program that exists here at South Sound 911. We have various folks coming to speak. Of course, we have Diana from our agency, Courtney with Volunteers of America, and then I think we have some folks as well from Department of Health who are here to provide some supplemental information. So I'll turn over to Diana. We've got lots of substantive information to cover on the topic and some interesting or positive things looking forward with respect to geolocation and so forth. So Diana.
Good morning. Thank you for having Courtney and I here to provide our update for you regarding the 988 and 911 co-location program and our updates for 2026. I am Diana Kaber, Communication Center Director here at South Sound 911, and Courtney Caldwell with Volunteers of America, Western Washington. Their interim clinical director for behavioral health is with us online regarding our presentation today.
Good morning, everyone. I'm glad to be here. Sorry I couldn't be there in person, but excited to talk with you about this today. So we wanted to start with just an overview of 911 and 988. So when a caller calls 911 for a mental health or behavioral health situation, the response is dependent on the area and jurisdiction in which they are located. So the resources usually include police, fire, EMS, DCR, or a co-responder. When someone calls 988, it is geo-routed to the nearest 988 center, meaning the call is connected to the center closest to the caller, but 988 doesn't see the caller's location. Historically, on the 988 side, we see that about 90% of contacts are appropriately resolved on the phone. About 8% result in a coordinated regional response like mobile crisis team or designated crisis responder. And then 2% of 988 contacts result in an emergency services intervention through 911.
A little bit of history on our program for anyone who's not seen us present before or followed it since 2022. Back in 2022, Volunteers of America, Western Washington, and us here at South Sound 911 were separately looking at how there has to be a better way to do this. We have separate systems that are helping the same people who are in crisis, whether it's mental health related or behavioral health related. And we knew that we're touching a lot of the same people through the work that we're doing, and other places had come up with ways to do it better. So we really wanted to come up with a no wrong door approach, where if you call 911 or you call 988, you're getting connected to the most appropriate resource for your situation that you're calling for. So separately, we're both researching, we're both looking for opportunity before we realized that we were each other's partner for a program like this. We came up with the goal when we started talking to partner to provide the most efficient and effective response for situations with a mental health component. And that really is something that we've stood by as the program's evolved over the last few years. This is a timeline, again, looking back at history of how we got here. We set out in 2022 after information gathering, seeing what's going on in the country, talking with different cities and agencies that are doing it well, ones who wish they had done it better, to figure out what we wanted to do. And then in fall of 2022, we started those conversations, the we being South Sound 911, Volunteers of America, Western Washington, our 988 provider, to be the first co-location program in the state of Washington. In summer of 2023, we reached that goal when we launched our pilot program as the first co-location program in Washington. 2023 to 2024 was the pilot phase of our program, and 2025 is when we transitioned from the pilot program to a permanent program. So what is our program? What are we doing here? We're looking at situations where we both help the same type of callers, the same types of situations. And because they call 911, historically their response was police, fire, or EMS. If they called 988, they were getting connected with mental health professionals to help with their situation. So the criteria for our program is assisting callers who have thoughts of suicide or someone who's with someone with thoughts of suicide, and looking to connect them with the best response. So today, if someone calls 911 with our program in place and they have thoughts of suicide, they are not looking for help. They are calling to notify us of a decision that's been made. That call stays with a 911 call taker for an appropriate response to be dispatched for law, fire, and medical aid. Same with a person who's with someone in that same situation. For situations where a suicide attempt has occurred or a death by suicide, that stays with our 911 call taker. It's processed in a traditional manner that you would expect. For people who are with someone with thoughts of suicide and there's not an immediate threat to themselves or those that are with them, we're connecting them to the 988 crisis counselor who's on the floor with us so that they can connect them to resources, they can provide support to them. Same for someone who's on scene or with someone who's having thoughts of suicide and looking for help, as well as our familiar callers who are calling, reporting the same situation that they've previously reported. And we've established a baseline for them that this is a mental health or behavioral health situation, not the situation that they're describing when they call. And then we have a third piece of this, which is for when there is a response by police, fire, or medical aid. For someone who's having thoughts of suicide, there's an immediate threat to themselves or others, and they want help, or someone who is with someone in that same situation. And in that situation, our 911 call taker is staying on the line with a 988 counselor. So the counselor can provide appropriate de-escalation, and the 911 call taker can do what they do best, which is relay the information to the responders en route. This workflow shows what is going on in the background and hopefully provides a visual aid to everyone when there is going to be a response from law, fire, or medical aid, but we receive the call on 911 and it meets that situation where a 988 counselor can also provide de-escalation. So the top is really how every call we receive is processed. We get the call, we determine if it's ours to handle. If it's not, we give it to the appropriate PSAP or 911 answering center. If it is ours, we start processing and screening the call. So really what we're focusing on today is the boxes that are the blue and the pink. So again, we have police, fire, EMS dispatched to this call, and we're adding in a crisis counselor. They're providing de-escalation for crews who are en route. And we've really seen some positive outcomes from this to help prepare the caller or the people with the caller for what's to happen when they arrive on scene, or to relay information that's coming in to dispatch over the radio from those on scene to the caller who's still on the line. This second workflow is what's happening when we're truly utilizing this program as diversion. So the top remains the same for how we process our calls when they're received. And again, we're focusing on those blue and pink boxes toward the bottom. We're connecting them with a warm transfer to the counselor who's physically located on our 911 center, the same equipment. And that really is a key piece to what makes this successful. We're getting them on the phone with the counselor, introducing them as our partner, and the counselor takes over the call. Our 911 call taker now is available to answer the next incoming emergency call. And if for some reason that situation changes, they're immediately able to get a 911 call taker back on the line to enter a call for police, fire, or medical aid.
The program started with one counselor on site in June 2023. And so from June until the end of the year, we were really intentional about building the relationship between 988 and 911 in this partnership. The counselor, Rachel, pictured there in that picture in the middle, she spent a lot of time talking with 911 staff on the comm floor and collaboratively bridging gaps in understanding between the two systems and gaining a better understanding of how 988 could best support 911 and our community members. So this period really allowed us to refine our transfer criteria and our practices to streamline ways of interacting with those calls. So in 2024, we used the data we identified in that initial period to expand and refine those practices. We expanded staffing by a few FTEs, and our one counselor was promoted to a program coordinator, which allowed her to oversee the VOA counselors and clinical operations on site as we expanded that staffing. We also began integrating into the South Sound 911 Training Academy and other settings on the PSAP side to make sure the program was highlighted for new comm center staff. In 2024, we also did an internal needs assessment to help us identify what populations and clinical presentations we were encountering in this program compared to what we're seeing in the larger 988 system. So in 2025, we did increase our staffing to 24/7 coverage, and we implemented a lead position and a program manager position. We're really fortunate that both the program manager and our lead are independently licensed, so they bring that clinical lens to the work. This structure allowed for really thorough quality assurance and improvement practices. And we were also able to use what we identified in our needs assessment to find training to support those clinical presentations we were seeing frequently in this work. So we identified cognitive behavioral therapy for psychosis as a good training to support the program. And so program staff completed that training by the end of 2025. We did see really positive impacts in our caller outcomes from this, which I'll cover on another slide. And in this year, we were also invited to participate in the state work group on warm transfer protocols for 911 to 988. And we were able to use what we had identified in our partnership to inform that body of work. In 2026, so far, we've been focused on maintaining our 24/7 staffing. We're expanding our data analysis through a dedicated data analyst position. And we've been working on expanding on our use of our 24/7 follow-up services program, which provides support and connection to resources within the context of an active or recent crisis. We're also really excited to have built into this partnership a regular supervisory review on the South Sound 911 side to identify those workflow and training opportunities.
We had somebody with their hand up. Is there somebody asking a question? Seeing nothing. Okay, continue.
Next slide, please. So this shows our stats from the year of 2025. So in 2025, the co-located team interacted with almost 1,400 calls. About 82% were consults where 988 was treated as the response, and the other 18% were conference-based calls where 988 assisted while units were en route. The most common outcomes in 2025 were crisis stabilized and familiar caller at baseline. We saw 80% of calls contained a stabilization component, and so that figure includes all calls that were not transferred back to 911 or referred to CPS or APS or another entity for further intervention. So this 80% does mirror the same rates that are seen in similar programs around the country. Next slide, please. And so this shows 2026, January through June of this year. So the co-located team at that point had interacted with 739 calls, which was a 6.5% increase in monthly volume compared to 2025. 84% were those consult transfers and 16% were conference-based assistance calls. The most common outcome we saw was crisis stabilized. And we did see a really significant shift from familiar caller at baseline to that crisis stabilized outcome following the completion of the cognitive behavioral therapy for psychosis training that counselors completed. We also saw that the rate of crisis stabilized as an outcome increased by 62% so far in 2026. We also did see a significant reduction in the percentage of calls that were suddenly ended by the caller. We saw slight increases in the percentage of events with a stabilization component and increases in referrals to VOA 988 follow-up services. Next slide, please. So looking ahead to 2027, on the 988 side, we have two areas we really want to see this program grow. One we're really excited about is in increasing our identification of tribally affiliated callers and maximizing connection to tribal resources. Volunteers of America Western Washington is the home of the Native and Strong Lifeline and the Native Resource Hub. So these provide 24/7 crisis services as a population-specific option of 988, and the Native Resource Hub provides care coordination between tribal and non-tribal resources. We see in our data analysis that we are encountering these tribally affiliated individuals in this program, and so we really want to use our internal resources to make sure they get the most culturally appropriate support. Another area we really want to see grow is in our referrals to our 24/7 VOA follow-up services. So our follow-up service is the only 24/7 standalone 988 follow-up program in the state. So this program involves certified peer counselors who work with help seekers for 4 to 6 weeks on average, supporting them with attainable goal setting and connection to resources. So we've seen really positive long-term outcomes on the 988 side, things like engagement in appropriate services and a reduction in their use of crisis and emergency services. So we're really hoping that through this program, maximizing these referrals will give us the sample size we need to analyze this data and continue to build on these outcomes and see them moving forward. And then I'll turn it over to Diana for the other two bullets.
The two areas in 2027 that we're focusing on here at South Sound 911 to continue to grow the program is the supervisor involvement. We have Karen Brown, one of our telecommunicator one supervisors, who's very involved with the program, a huge advocate for it. And she's been diving in to review calls and working with the program manager who's with Volunteers of America Western Washington here on site to look for ways that we can capture more calls. What calls are meeting the criteria that we could have utilized the program and maybe didn't, as well as reviewing better ways for us to work together during some of those calls that have a one-off situation that comes up so that we can train for it in the future. Karen recently created with Carly Swanson, one of our managers here, a training for continued education for all of our staff on the floor to continue to educate them on the program, the benefits of the program, and how to best utilize it. We also have an added manager to the involvement with the program, Amanda Calloway, that you will see in future presentations, who's working on continuing to grow the program. We're getting those fresh eyes in here who can see things and come up with ideas that we haven't thought of yet. We also are looking for opportunities to expand. Volunteers of America Western Washington provides chat services for 988. And so texting is not something that's new to them. We have not integrated that yet. We're looking forward to our new phone system that has text to 911 integrated into our actual phone system so that we can figure out the best way to implement that and include some of our familiar callers who reach us through text to 911. And then the positive impact. We gather a lot of data. We provide out a lot of statistics and data and the numbers for it. But I think the real reason that all of us came together to create this co-location program is for the people part of it and who we're actually helping and how we're making a difference. Courtney, I believe, has a couple of positive impact stories. If you don't mind sharing those before we hand them off to DOH, and I'll add mine at the end.
Yeah, definitely. So we had a couple of recent ones that I'd really like to share. One recently was a conference-based assistance call for a person who was actively suicidal and waiting for EMS. So the co-located 988 counselor was able to keep the person engaged, get them to put the means they had planned to use away, and was able to support 911 in gathering information about the person's plan, history, supports, coping strategies, and all the information was documented really effectively. So EMS had a clear picture of the situation before they arrived to help facilitate the best possible outcome given the circumstances. Another one that I thought was really exciting was we had a familiar caller who was presenting with symptoms of dementia, who had been calling 911 multiple times a day for years. So through this program and enhanced engagement with the caller, the ability for 988 to spend a little bit more time gathering information, counselors got the necessary information to coordinate with adult protective services and help connect the individual to appropriate care. So ultimately, the individual was placed in a facility to get the care needed, and since then, the calls to 911 have stopped. So it's always really exciting when we can see someone get where they need to go through that no wrong door approach. And Diana, would we like to turn it right over to DOH now?
I just had a couple of pieces to add also, and we've touched on them before, but with our 911 call takers in particular, but everyone on the floor answering the emergency calls and dispatching them. Before we started this program, what we were hearing is that helplessness or the hopelessness in helping people. That's why they started here. That's why they take the tough calls, is to help the people who call. And there were so many callers with mental health or behavioral health situations that they saw calling time and time again, where it's clear that they're not getting connected to that right help. And so that last example that Courtney just shared really just highlights that that's impacting and changing that person's life who was calling us, but it's changing the people on the floor and their ability to show up every day and keep doing this work because they feel like they're connecting them to the right resources to get the help they need, rather than just taking the call, entering the call, and talking to them again later. And then another piece is building the trust between these two systems. They're two systems helping the same people, sometimes different people with similar situations. And we're seeing that at the state level and the national level of these two systems coming together and working to build trust and working to understand each other so that we can continue to evolve, whether it's a co-located program or a different model. We're able to share our experiences so that people can see there's multiple ways to do it. So work within your means, work within your collaborations that you have to create something that works for you. And Kevin, did you have something to add before we pass it off?
Thanks.
Yes, Mr. Branson.
Thank you, Mr. Chair. Before we move on, I had a couple of points that I'd like you to clarify. First of all, I think my perception is that, as we were the first program of this sort in the state, and I think that's a great credit both to South Sound 911 and to the Volunteers of America for Western Washington that we've gone on and that the program has evolved to being a permanent program and that it moves forward. Are we aware of others trying to replicate what we are doing here in the state, or are we still an outlier with our own unique vision for serving Pierce County?
I would say that we're a front runner in this model. Valleycom, which is our neighbors who service the Kent area, Federal Way, they're comparable in a number of ways to our center. And they had a collaboration, a co-location model with Crisis Connections. And they have chosen to not be co-located, but they still have a partnership that's evolved after their initial pilot. So they're not in the same facility sharing the same technology. So they've evolved to a different model. Over in Spokane, they also have a partnership, but it's not co-located. They share some CAD data through their agreements, and they have a pretty strong partnership, but it's a different model.
So in your presentation, there were a number of points where you identified a group of folks as familiar callers. How does someone get that label?
So we have a number of callers who we've entered. So if someone calls and whatever they're reporting, we handle the call based on what they're sharing with us as their situation. And then responders respond out and they've identified that situation wasn't occurring. So one familiar caller that we have calls because there's noises in their attic. So we first enter the call as someone should go check out their house. What if there's someone breaking into their house? They go out, they meet with the person, they determine that it's a mental health situation, that there's no one in their attic, and then they continue to call us. We have some who've called us 100 times in an hour when they start calling. We have others who call us every Thursday around 7 p.m. So it really varies on the individual, but once it's been identified by first responders that that's not the situation being reported, they continue to call us and it's that same situation. Now, sometimes if we're using the attic example, they call all the time and they say, there's someone in my attic, there's someone in my attic, there's someone in my attic. And we utilize this program to connect them to 988, which has had a huge benefit for us, like the example Courtney shared. But other times they call back and they're like, someone just stole my car. That's not baseline. So we're entering a call for police to respond out there to identify, was the car stolen? Is this another symptom of what's going on? And a lot of times they're calling about the same thing. And when they report that one-off, that actually happened. And so it's really important that at baseline or reporting the same situation is an important key factor. But how they're first identified is that first responders responded out, whether it was police or fire or EMS, and they identify that when they're reporting this, that's not happening.
Well, I am glad to hear that you are alert to whether a call is a one-off, as you just describe it, so that we don't fall into the situation of the fable of the boy who called wolf, and when there really is something, no one wants to believe him. So I'm glad that you do that. But my I guess my last question is. There's a considerable amount of effort on a variety of people that's here. And I'm kind of wondering how stable on the 988 side, the funding to continue to be in, participate in, and grow this program is.
Let Courtney speak to that.
Yeah, thank you for that question. I can speak for Volunteers of America that we're committed to supporting this program as long as funding is available for it. And then I'm really excited that we have our partners here from Department of Health to speak to the larger body of work, which I think might provide a more substantial answer to the rest of that question.
All right, thank you. Thank you, Mr. Chair.
All right, before we switch over to Department of Health, just a few comments to interject. What you're sort of seeing here, board and folks that are joining us today, you've heard from Courtney and Diana about sort of the actual implementation of the program at a specific place. That's Pierce County, so you're seeing it on the ground. Another emphasis point, though, we talked about co-location. Co-location right now appears to be a unique arrangement. There was 3 pilots, and this program persisted here at South Sound 901. So it's sort of unusual, but a powerful and effective relationship has formed between Volunteers of America who are physically present here and our own staff. It's helping people, you can see, in a meaningful way. We use these terms and the lay folks might not understand them. Emergent or emergency communications fundamentally are about getting police, fire, EMS to somebody, but sometimes we realize the response is not appropriate for fire, police, EMS. It's a person in crisis And so you can see the melding of the concepts here. We have 988 for the folks who are in crisis, but maybe not emergent circumstances, and emergent for the folks who are really experiencing that with life, property, personal health. So now we're going to move our lens back a little bit and talk to the Department of Health. First of all, I got to thank the Department of Health for being super helpful. This is a statewide program. 988 is funded at the state level through program. And I did these sort of random reach outs and managed to get Lonnie from the Department of Health, who oversees this program. So much thanks to Lonnie for supplying us with a lot of information. I think Matt's here today to present. So what you're going to hear fundamentally is sort of the state view of the program, and then two key aspects. One will be the geolocation component, and that's a modern evolution, and also a map change, because in the original iteration, I think there was just 2 crisis centers, and now we've got 4 or 5 in the state. So you'll see that from the Department of Health. So thank you.
Hi all, thank you so much for having us today. My name is Beth Shermans, and I work with the Washington State Department of Health in our 988 Crisis Systems section. I am the 988 Engagement, Equity, and Partner Relations Supervisor, and I'm joined here today with Lonnie Peterson, our 988 Crisis Systems Section Manager, and Matt Scanlon, who leads our diversion work. We were invited to join the board today to provide a few bits of information about 988 to you all, some high-level details about 988, an overview of how 988 services are geo-routed, some details about the legislative required process called hub designation, and we're here to answer any questions you might have about our 988 system in Washington State. Next slide, please. Our Department of Health 988 Crisis Systems section oversees a few key areas across the 988 crisis care continuum. While what we're talking about today is our co-location with 911 and diversion work, we also do communications across the state, including a media campaign. We participate in community engagement, including giving presentations, tabling at events, and raising awareness for 988. And that also includes working with people with lived experience of behavioral health crisis or suicidality and gathering their feedback and input about the 988 system. We oversee the state contracts for 988. We do the 988 911 diversion work. We also work with our 988 hubs to ensure that the training across all of our 988 hubs in Washington is streamlined. And in addition to meeting those national requirements, also meet state requirements set out by legislation. And finally, but not least, we participate in tribal engagement. As a government agency, we are required to participate in government-to-government relationships with Washington State's 29 federally recognized tribes. And so we do a lot of work in ensuring our tribal partners have a voice in the 988 system, give us feedback about the 988 system, and are able to set some guidance about 988 for tribal members. The Department of Health contracts 988 services from organizations like Volunteers of America of Western Washington, where Courtney is here from. And these 988 providers are referred to as 988 contact hubs. The hub services align with requirements from Department of Health and Vibrant, who is the national administrator of 988. For example, 988 contact hubs are required to provide core behavioral health crisis services, such as suicide risk assessments, imminent risk assessments, de-escalation, safety planning, responding to calls, texts, and chats within required timeframes, meeting training requirements, and offering follow-up services for those experiencing current suicidal or homicidal ideation within the past 24 hours. Next slide, please. The 988 Suicide and Crisis Lifeline launched in July of 2022. And it's a 3-digit number that's easy to remember for anyone seeking help for any type of emotional distress or behavioral health crisis. And by contacting 988, they can reach a trained crisis counselor via phone, text, or chat 24 hours a day, 7 days a week. And it can be for thoughts of suicide, concerns about substance use, or even worries about a loved one. You do not need to be contacting about yourself to contact 988 and receive support. 988 is free and confidential. In Washington State, there is a 40-cent line fee on all cell phone and voice over landline and voice over internet phones that cover the 988 services in Washington, in addition to getting some federal grants to support 988 funding here. 988 is confidential in that you don't need to tell someone any identifying information about yourself to be able to access and receive support. What you share about you when contacting 988 is completely up to you, aside from the 988 crisis counselor will be able to see your phone number if you're calling or texting, or your internet address, your IP address, if you are chatting online. Interpretation services are available in over 240 languages and dialects in 988. Next slide, please. There are 4 specialized lines when contacting 988. 3 of these happen at the national level, and 1 of these happens at the statewide level. When you call 988, you can press 1 to reach the Veterans Crisis Line. You can also chat online or text to reach that line specifically. And that line is for service members, veterans, National Guard and Reserve members, and those who support them. You do not have to be enrolled in VA benefits or healthcare to be able to reach the Veterans Crisis Line. The Spanish language line is option 2 if you call, or you can chat online or also text Ayuda to 988 and receive support from someone in Spanish language. So that does not go through translation services. That is working with a crisis counselor who is fully fluent in Spanish to support someone in Spanish language. The other national line is American Sign Language. So you can go to 988lifeline.org and click on Deaf or Hard of Hearing at the top of the page and click ASL Now and do video chat with a crisis counselor in ASL. And then one of our lines that is only available in Washington State is the Native and Strong Lifeline, which is the first of its kind in the 988 system, but hopefully not the last. But it is a crisis line by and for Native people who are living in Washington State. You do not have to be a registered tribal member to access the Native and Strong Lifeline. And all of the Native and Strong Lifeline crisis counselors are either tribal members or closely related descendants. Counselors from the Native and Strong Lifeline not only go through all of the standard training that all 988 Lifeline crisis counselors go through, but also take additional trainings to best support Native people with culturally affirming practices. The Native and Strong Lifeline is very proudly operated within Volunteers of America of Western Washington, who has really been a leader in supporting that work and building out that work since its launch. And I will now pass it over to Matt Scanlon. And next slide, please.
Yeah, thanks, Beth. So next, I'll share some information with you all about geo-routing processes for 988. Geo-routing assists help seekers to reach the 988 contact hub closest to their physical location based on the nearest cell phone tower. Geo-routing only uses general location data, which maintains privacy and confidentiality for all help seekers. The 988 Lifeline doesn't receive or store pinpoint data or other detailed location information. Geo-routing helps 988 serve help seekers more effectively by connecting them to their closest 988 contact hub, who can assist them with local resources. Right now, 988 calls in Washington are routed using 2 methods, by area code and by geo-routing. Currently, we need both methods because not all wireless carriers have implemented geo-routing yet. At this time, only Verizon, AT&T, and T-Mobile geo-route calls. According to Vibrant, the national administrator of 988, contacts from these carriers make up 70% of the 988 network volume. However, other smaller phone carriers must implement call geo-routing by December 2026, so pretty soon here. So all calls will be geo-routed in the near future. And national phone carriers must implement text geo-routing by April 2027, and smaller carriers must begin geo-routing text by October 2028. If a 988 call is geo-routed in Pierce County, it's routed to its designated 988 contact hub crisis connections. If not answered then, it goes through a backup process. So if crisis Crisis Connections is unable to answer a call, the call will be routed to Volunteers of America Western Washington, and if they can't answer the call, it gets routed to Frontier Behavioral Health. The purpose of in-state backup routing is to ensure that most, if not all, 988 calls are answered by an in-state 988 provider. In the event that no in-state 988 hub is able to respond, then the call goes to national backup. With regards to diversion efforts, South Sound 911 warm transfers certain behavioral health related 911 calls directly to Volunteers of America Western Washington. So no geo-routing is used for 911 988 diversion efforts. More information is available on this 2-pager about 988 geo-routing. We can also put the link to that in the chat, but it's also in the slides that went out to you all. Next slide, please. And then recent legislation directed the Department of Health to designate 988 contact hubs to answer calls, texts, and chats. After reviewing applications from organizations who applied to become 988 contact hubs, DOH designated 4 separate 988 contact hubs. As of July 1st, 2026, those 4 separate 988 contact hubs are Crisis Connections, Frontier Behavioral Health, Volunteers of America Western Washington, and Olympic Health and Recovery Services. Prior to the 988 contact hub designation process, there were 3 988 crisis centers in Washington since 988 launched in July of 2022. The new 988 provider is Olympic Health and Recovery Services, shown here on this map in purple. And notably, each of these 988 contact hubs are also the regional crisis line provider for their geographic coverage areas displayed on the map. A big function of regional crisis lines is to deploy mobile crisis teams as needed for behavioral health crises. And 988 coordinates with the regional crisis lines when they feel a help seeker would benefit from the in-person support provided by mobile crisis teams. So the hub designation process helped improve alignment of the 988 and regional crisis line systems services. This helps improve continuity of care and can help streamline resources like staffing and management, technology, and facilities across the 988 and regional crisis line systems. Basically, it's just helping streamline logistics and the help seeker experience across those 2 systems. So with the hub designation process and the addition of another 988 provider came some changes to the geographic coverage of 988 services. So, for example, as of July 1st, 2026, Crisis Connections is the contact hub for Pierce County. So if someone directly calls 988 in Pierce County and their call is geo-routed, it will be routed to Crisis Connections. Previously, that call to 988 would have been routed to Volunteers of America Western Washington. The hub designation map changes have some implications for 911 988 diversion efforts too. As a reminder, the 911 988 diversion efforts in Washington began with that pilot phase in 2024, although the Volunteer of America had a smaller pilot before that as well. But at that point in 2024, both Volunteers of America Western Washington and South Sound 911's jurisdictions included Pierce County. So when the pilot phase started, VOA and South Sound 911 partnered together to warm transfer certain 911 behavioral health calls from South Sound 911 to Volunteers of America 988. Following the 988 hub designation process as of July 2026, Pierce County is technically in Crisis Connections 988 jurisdiction. However, with regards to 911 988 diversion efforts, currently there are no plans to change the VOA and South Sound 911 partnership. Next slide, please. And I think at this point, we're ready for questions, and Beth and I are here, as well as Lonnie, the 988 Crisis Systems Manager, and then, of course, Courtney and Diana.
And so to the board, if you have questions, DOH is not responsible for hosting all the questions. So just feel free to ask questions, and whoever is appropriate will respond, whether or not that's Courtney or Diana or the DOH folks. Just a quick thank you, by the way, to Lonnie, Matt, and Beth, also for joining us from DOH and for the presentation. Questions, board? Looks like...
Go ahead.
Thank you, Vice Chair, and appreciate the presentation. And thank you all for the work around 988. Super important. One of the questions I had is in regards to the 40-cent line fee. I heard you mention landlines and VoIPs. Funding, does that include cell phones as well? Because I wonder about, I know landlines themselves are kind of reducing in number over time, so I'm curious about that funding source. Thank you.
Yes, it does include cell phones as well. Apologies if I missed that one in the list.
No worries. I might have misheard. Thank you for that clarification. And then separate from that, maybe this is kind of a dual question. I noticed during the first presentation, talked about increasing identification for tribal affiliated callers, but based on my understanding of the other presentation, there's basically a number that you press when you call 988 if you are a veteran. So does that really peel off a lot of folks that could be veteran callers to the 988 dispatch here? Or I'm just trying to see where that diversion kind of goes, and how are we connecting veterans that might have went through the pool right back to, because there's a lot of veteran resources out there specifically.
Sure, I'll let Courtney speak to that.
Yeah, so I guess one thing I want to clarify is the co-located program handles only calls that reach 911 first that contain a mental health, behavioral health component. That program doesn't handle calls that come from the larger 988 system, as in like somebody dialing 988 and then pressing one of those dial pad options. So we have other practices to identify components of identity that could be relevant to the intervention they're provided. So counselors are trained to assess for if someone's a veteran, if that's related to their current crisis. And those are questions we ask, and it's data we collect when available, when someone's willing to provide it. And so from there, we have a resource directory that counselors use that they would then connect those callers to applicable resources.
Great. Thank you.
Yeah.
Thank you so much for that clarification. I appreciate that. That helps me better understand how things are happening. I just be curious of, Pierce County is a very veteran heavy population, so I'm curious of maybe what that data looks like. I know you don't have it here right in front of us, but I'm just curious about that. Other than that, just to really appreciate all the work, the numbers. I think as more people learn about this system, and it's as a resource, I think it's really important that we are all talking about it. I think most people go through some sort of mental health crisis at some point in their life, and I could certainly see this being utilized as a resource. I certainly could have used it in the past during other times. So just appreciate all the work, and really looking forward to seeing the program continue to expand and support people. Thank you.
Executive Mel.
Thanks, Vice Chair McGilligan. Thank you for making sure we spent some quality time getting to really appreciate and understand what's going on with the 988 system. It's something that's really important to, I think, all of us. So thank you for the work. It's not easy to change systems and integrate things and think differently. But a lot of work has been done over the past few years to do that. And so thanks for showing the homework and demonstrating. As my colleagues have said, it's a real important service to this growing community. I just want to continue to encourage further collaboration and integration of the systems. So continuing to come back to the board to show how we're continuing to do that would be really appreciated. Call on me and the rest of us, anything we can do with our state partners or local partners to continue to really help facilitate that collaboration and that integration. It's really important. I have two questions. You shared some really good examples of positive impact from users, which is powerful. I'm wondering if you have anything to share now, or maybe in the next time you come back, about how it has helped first responders maybe take a load off of their load so they can be on other calls, or do you have data or anecdotes about how it's helping our first responder community?
I think anecdotally, and in previous presentations, I think we've touched on a couple of them, so it's not extremely recent. But the data that Courtney shared in the table that I see you have in front of you, the diversion, I think alone is helping our first responder partners, the police, fire, and medical, not respond to calls that maybe aren't most suited or most appropriate, where they have a mental health or behavioral health component. So that diversion piece alone, rather than us taking the call, entering the call, sending the folks, I think there's a positive impact there for sure. On the floor, we have seen a positive impact. Both, I shared a little bit today, more anecdotally, of they started this job to help people. And when they talk to the same people and they're seeing they don't seem to be getting help, or the feeling that they're not getting help because we're continuing this cycle, there was some feeling of hopelessness. And what am I doing here? Talking to the same person 100 times in an hour, 30 times in an hour. Where's the help for them? And they're seeing that, and we're hearing that from our staff. But also we've seen support, which is not why we started the program, but something that Courtney and I are proud that's occurred, is the support from the diversion counselors to our 911 call takers after some of the tough calls. We have peer support. We have chaplains that provide services to us, but they're building those relationships while they're sitting next to each other, taking the same calls. Or the diversion counselor just heard the call taker walk a parent through CPR on their child, and they turn around and they check in with them, and they go for a walk outside, and they provide support that they're trained to do. But it's not the capacity of the program specifically. We also had a call that we received here that was the death of a child of an employee here. And the counselors here were coming on shift, and they checked in with the supervisor. They said, "We just heard what happened. How do we support your staff? Because your staff are still trying to help all these calls coming in, and they need help too." And so those are some of the pieces that aren't visible, and it's not necessarily what the program, does, but it's doing it.
Yeah.
Yeah.
Thanks for that. My last question, and I think this is a longer conversation for us to have as a broader community, and certainly here, it is you've spent a lot of time explaining the value of the program, the 988 program, primarily from someone who is potentially suicidal or at risk of suicide or having an emotional crisis. There's a real need for that, and I understand why we are focused on that here. There's another element in our community that I see all the time, and we need to figure out how to get better at delivering alternative crisis response, not necessarily to someone who is suicidal, but to the person who's experiencing a behavioral health crisis. And as a bystander, as a layperson, you're watching this happen on a city street, in your neighborhood. Maybe it's a friend, maybe it's in home, in business. And the person could be exhibiting any number of behaviors that's maybe not suicidal, but it's clearly a behavioral health crisis. And it just does, my experience tells me that we are not equipped with helping lay people. I've tried to navigate this myself countless times and have not done it effectively. Transferred. It is so not straightforward about how to, when you visually see someone out in community that needs help, they don't need someone with a badge and a gun. They need mental health support. Or they need some sort of services, and how we help get that support to that person seems to be really lacking, and we're not unique, seems to be really lacking here, I suspect across the country. And I am eager to figure out how we get, how we're getting 988 more ubiquitous here. 911's very ubiquitous, thank goodness. 988 is ubiquitous. It's this other layer of folks who are in crisis or disruptive to themselves, maybe disruptive to business or others, who need help, and not someone with a badge and a gun.
Can answer some of that. I think you really raised a really important point, and just one way that we're starting to make inroads on that. There certainly are people who are going to be bystanders to emotionally distressful events, and it'd be important to get them connected to 988. And part of the challenge is, 988 is still a relatively new service, so folks are just sometimes not aware of it, right? So we have a lot of work within our Department of Health focused on community engagement, like Beth mentioned earlier. So there's efforts to just raise awareness. But one kind of like key way that we're starting to do that is I've been collaborating with the DOH EMS program here on efforts to do communications to the EMS profession. So we actually, I think just a week ago, sent out an email to the listserv of all the EMS professionals in the state to provide them information about 988 and like some resources that they can, like printed materials and promotional materials about 988, so that as appropriate, they can share that out with EMS professionals, but also the communities that they serve and their patient population. And part of that, is they're as feasible, if you're on scene with a patient and they're going through a crisis, right? There can be loved ones or family and friends or other people on the scene as well that can be kind of a bystander to that and be distressed, and that could be an opportunity if EMS has the time available to do that kind of like sidebar and provide information about 988. So that's one way that we're kind of starting that. That's an early effort. So we sent out that email. We've also sent some language in their newsletter that they send out to their leadership across the state, and we're kind of continuing to do kind of more communication on that front. So that's one way. And then of course the other kind of broader way is just ongoing community engagement type efforts.
Thank you.
We appreciate the suggestion, though, Executive Mello. You're pointing out in the continuum of care, we can expand further because there continue to be gaps. So we'll continue to think.
Thank you. I guess the last thing I would indicate is different community, we serve all the law enforcement and fire and EMS agencies. And some communities have alternative crisis response. Tacoma has alternative crisis response. Some other communities do, many don't. And so the service delivery is very unequal and uneven across the county. And so whether it be, someone who's sleeping in a doorway, someone experiencing homelessness, or someone walking around a business district in Bonnie Lake or Puyallup or Parkland, clearly unwell, we're not set up to get the right help to the right place in a very efficient way yet, other than taking a police officer who has a whole queue of calls to get to, that maybe they're probably not the right resource for that thing that needs alternative crisis response across the county. So I'm eager to work on this. Thank you.
Thank you. Well, thank you very much. Great presentation. Oh, I'm sorry, Michael. And we got Robin. So Michael, go first.
Okay. I guess my question has to do with going back to my concern about finances and having been referred to the Department of Health presentation. And I guess that I'm concerned about the hub designation map that changed Pierce County's primary contact hub going on. And I know, Mr. Scott, you said that, well, that won't affect the operation that we have here, but that's not very reassuring because so there's an existing contract that I guess isn't being abruptly canceled, but as this map is being used for future budget decisions in your agency and at the state, it seems that are there some specific guardrails in the hub designation redevelopment that protect our program here to ensure that it will continue to have the funding that it is, Or is that going to become something that budgeters are going to look at this map and not necessarily want to have the same contract relationships?
Lonnie, are you the one that's going to answer this question?
I am, thank you. And for some reason, I can't get my camera to turn on, so apologies for that. But yeah, like Matt shared, we don't have any plans at all to change the partnership between Volunteers of America, Western Washington, and South Sound 911 for the diversion work. I know the hub coverage map did change with hub designation in July of this year. But that was really designed to regionally align 988 and regional crisis line services, which is a little bit different from the diversion partnerships that we have. So, and even if we wanted to make a change or we were getting, pressure to make a change, we would for sure be bringing all of our partners to the table for that conversation. It definitely wouldn't be happening by DOH unilaterally. But at this time, we've got full support from our agency leadership to keep this partnership the way it is.
Does this change in hub designation going to affect how calls that come into 911 and get referred to 988 to Volunteers of America are then going to be further referred, or are we going to end up with another organization, the Crisis Connections, that have to be at the end of that referral process?
So not at this time. We have been talking about trying to figure out if there's a way, if for some reason, well, I guess it's different with South Sound 911 and VOA's partnership because the staff are co-located. That's currently the only partnership that we have right now that has a co-location model. So it wouldn't make sense. There would always be staff available to take the diverted calls from 911 to 988. And the other partnerships that we have across the state that aren't co-located, there could be instances where their 911 PSAP is needing to divert a call from 911 to 988. That 988 center or hub may not be able to take that call for whatever reason. And then there's a process for them to get into a queue for the counselor to be able to answer those 911 diverted calls. So we've been talking with statewide 911 about figuring out a backup, some sort of in-state backup process for those particular instances. I don't think that happens very often, but I think it's much, much less likely to happen with the VOA and South Sound 911 diversion partnership because staff are co-located.
And then on funding more broadly for the 988 system, that Governor Ferguson has highlighted that this coming biennium, the budget is doing budgeting things is going to be stressful for the state, and that he's asked agencies to identify percentage cuts going across to do that. So within the Department of Health, is 988 funding at risk of being reduced? And if that's uncertain, is there something that jurisdictions like the City of Lakewood or organizations like South Sound 911 should be advocating within our legislative bodies to sustain 988 funding? Or are you not concerned that internally the Department of Health isn't looking at 988 as a bill payer?
Yeah, that's a great question. So 988 at the state level is primarily funded through that 988 tax line fee that we all pay into every month. And that's not general fund state funds, which are the funds that are most at risk right now because of the state budget deficit. So the 988 line tax funds are a little bit more protected. So Department of Health is not looking at those funds to try to help balance any budgets. We do have that funding currently for the current 3 diversion partnerships that we have across the state, including the South Sound 911 and VOA partnership. We also have some funding, hopefully going into this next federal fiscal year through our Substance Abuse and Mental Health Services Administration grant. That'll hopefully help support some additional diversion expansion. And we'd love to expand partnerships to additional PSAPs across the state as funding allows. So we're hoping with some of these federal funds that will hopefully be coming our way in the fall, that we'll be able to do that. We also we have to request funding from the tax line every year for what we are kind of projected for what we need for the coming year. And so we've been trying to figure out, how much additional funding we want to request from that tax line account to expand current partnerships or add additional partnerships for this work. So that's something we have kind of ongoing conversations about.
Okay, and in that, I didn't hear, is there any way we can help?
Yes, always. If you're ever, speaking with legislators or partners across the state that could be helpful in this work, we're always happy for folks to be able to do that.
Thank you. And Mr. Chair, I would just add one anecdote to Executive Mello's expressed concern about the gap with people with behavioral health issues, but not quite suicidal. I was at a community meeting 2 weeks ago, and one of the attendees at the meeting was telling others at the meeting how he's really depressed at his efforts to try to get help with homelessness and employment and some other things. And that he was trying to figure out who to call, and he had to be able to go and do that. And one of the other persons in the meeting told him that the way he could definitely get some help, or at least get someone to listen to them, is to call 988 and say he was suicidal and cite all his problems as why he was suicidal, and that someone would at least pay attention to him then where he's feeling not being paid attention to. And that's not a strategy we want to folks to do that. But if we don't provide an alternative, that becomes a realistic strategy to some.
Thank you, Ms. Branstetter. Robin, did you have something?
Councilmember Branstetter was asking questions along the lines of mine in regards to the hub designation. And I'm sure it's very complicated and has to do with the other crisis response systems and funding and contracts. There's probably not a response to this by the Department of Health. I just wanted to make the comment that our relationship with Volunteers of America, thanks to South Sound 911 and Diana's work and her team, I feel like, not knowing a whole lot, I feel like Volunteers of America probably knows the resources in Pierce County very well. So it's kind of unfortunate that they are not also our 988 provider, because I'm sure staff talk, and it would be nice for people that are calling 988 directly to be connected with Volunteers of America. But I'm sure there's reasons, but just something to consider for the Department of Health in the future. We really appreciate, that personal connection that we've made with this organization, and we're such great partners. Thank you.
Thank you. Before we move on, Lonnie, you were talking about that the funding you get from the state is not the general fund. So are you telling me that the appropriation is an enterprise fund?
It's actually a tax fund. So we all pay into that line tax every month. So go ahead.
But if it's not out of the general fund, it should be an enterprise fund that cannot be taken away. Is that true?
That I've never heard that terminology, but it's possible. But it for sure is not general fund state funding.
Yeah. Usually if you don't have to go to the appropriation from finance, because you're taking tax dollars and it's for this one project, there should be no reason that somebody can tap into it. So you might want to check on that. Because as I say, I think what we just heard from some of the board members is there's a possibility that the funding may go down. And if that happens, then the services will go away. And I don't think anybody's looking to do that. And I think as board member Dennison says, we've got a very good relationship with VOA. And I'd hate to see that hurt because funding is going to go away. So great presentation, as I said before. Deanna, thank you very much. Also, Courtney, I can't thank you enough for being online and sharing this information with us. And we will keep this in the forefront and make sure that we watch what goes on. So if there's any change that's going to affect this program, we'd like it to come before the board. Is that good? Everybody good? Thank you.
Vice Chair. Thank you again, Department of Health, Lonnie, Matt, and Beth.
Director.
We have a PSCOC report. I think Chief McGrady is going to provide that today.
Good morning, everybody. And just a quick comment on the presentation. It was fantastic, and kind of to Executive Bell's comments. As a first responder, these programs do absolutely have an impact on us as well. Anecdotally, just even the stories from some of our crews. So I appreciate the conversation and just the eagerness to continue that dialogue and to continue to have conversations on filling those gaps. So thank you guys for that. As far as the PSCOC report, we met on August 6th. Executive Director Yamamoto reviewed the current communications assessment formula. There was, as well as the smoothing factors, both on the law and fire representatives generally supported retaining the current structure. We did both provide some clarifying language to Executive Mello, or sorry, Edie Yamamoto, on just the definitions for calls for service as well as what counts as CAD. So just clarifying some of that language that was provided there. And then there was conversation around just the Finance Director Caviezel presented on the communication offset options, which I believe she has a presentation for the board here later today, so I will not steal her thunder. You guys will get a presentation on that here shortly. Most of the conversation was around the communication offset options, which would be presented, as well as changes to essentially the floor and ceiling discussion, the 4% and 7%, adjusting those. So that is coming. I won't get into the details on that. On the technology front, CTO Varicella gave updated timelines on the Vesta 901 call handling system, as well as the Motorola RMS integration or migration. Provided that to the group. The Vesta, the call handling system is anticipated to go live by end of 2027. And then the going through with the RMS go live date has been delayed just because of some of the project development and project management and development issues. But that work is continuing on. The existing legacy RMS does remain functional. Additionally, there was some conversation on the development of a policy for sharing CAD data across different agencies. Law enforcement representatives did support a idea of just providing some agency notification if somebody is wanting to pull data from a partner agency, being able to have some awareness on that. And then on the fire side, just protection of any kind of HIPAA information was discussed and maintaining that privacy. So South Sound is going to continue to utilize the feedback from that group to develop a process to kind of accommodate both of those requests from both the law and fire side. With that kind of summarizes in general the report, and I'm sure Finance Director Caviezel's got a lot more detail on the finance side, unless anybody has any questions. Yeah.
Questions, comments? Thank you, Chief.
All right.
Executive Director.
Mr. Vice Chair and Board, we're to that portion of our agenda where we talk about the folks that work on the line. And we've got two incidents to share today just about the work they do. And I think perhaps the theme is professionalism. The first one is a water rescue, a flipped kayak. And this was our telecommunicator, Shay Greenway. So this is the supervisor writing, and I'll just read it to you. On June 9, 2026, Shay received a call from a mom reporting that she and her teenage son had flipped their kayak in the Puget Sound and were in the water. Both were wearing life jackets, but their kayak was drifting away and they were too far from the shore to swim to safety. Shay initially lost phone contact because I guess if you're calling from the Puget Sound, you probably don't have the best reception. But then reestablished the call and it was able to get information over to first responders. Both the mother and son were eventually rescued and taken to safety, but they were in the water for about an hour. So bodies were quite chilled and they were headed towards hypothermia. The supervisor writing about Shay noted that Shay remained calm throughout the entirety of the incident. She kept the caller engaged and provided clear and effective directions on what to do while they were in the water and in the highly stressful situation. So just shining through professionalism. Thank you very much, Shay. Then a fatality collision, a mass casualty incident. Fire dispatcher Sarah Conlon, Stephanie McFadden, and Amber Trowbridge worked this particular one. On June 11, 2026, Sarah, Stephanie, and Amber were working a busy shift when a mass casualty incident call came in. There was a box truck that collided with a school bus, and yes, there were children. There were approximately 40 children on board, many of which sustained minor injuries, but the collision was bad enough to be fatal for the box truck car driver. Because there's so many folks involved, Sarah, Stephanie, and Amber were fully engaged and had to work the incident extensively. There were 21 fire units that responded, plus additional engines, medics, and rescue units. The supervisor who reviewed the calls commented that the dispatchers worked seamlessly and flawlessly together to get the job done with skill and precision. So I just want to say a shout out to them again, and thank you very much, Sarah, Stephanie, and Amber, for being pros. You never know when the call is going to come, and you never know the size, so they're ready. Thank you. Shifting over, we've got a couple of announcements that I'd like to make. We'll do a little bit of celebration at the end. Kathy McAlpine, some of you may know her, is going to be replacing Mark, and Mark and Kathy are here today. So please stick around after the meeting. We'll have some cake. I suppose we can congratulate Mark on his retirement and then welcome Kathy. Kathy's longtime law enforcement. She was, if you read her resume, she was with Tacoma Police Department as long as Tacoma Police Department existed. And she worked every single position in Tacoma. And then Oregon decided, hey, she's so good, let's take her. And so she went down to Tigard and became a chief of police down there. And then Oregon said, well, you're not done yet. And so then they moved her up higher into the Oregon's administration. So we're lucky to have Kathy back. She's a Pierce County resident. And you can see there's, even between Mark and Kathy, a strong synergy, and we're delighted to have that quality handoff. So folks want to come up now? Why not? So thank you, Mark, for more than a decade of being a pillar in the organization. And by the way, we highly appreciate the recommendation and you helping us land Kathy, because we're looking forward to that. So
you're more than welcome. Kathy and I have known each other for a long time. Our paths crossed and we worked on multiple projects when we were both in law enforcement. When Kathy called me up and said, hey, I might be interested in your job. Tell me what you do. I cannot say how excited I was about that. She is a consummate professional that has done great things in the public safety sector already. She's going to do more here. And for me personally, not only is she a professional and a good person, but I know walking out the door, she's going to take care of this organization and she's going to take care of you all. And the ball's not going to get dropped. And the future is very bright for South Sound 911, and there's a lot still to do, and she's the right person to do it. So congratulations. I'm so happy for you.
Well, thank you, Mark. Appreciate it. And it's good to see some familiar faces. It's always nice to come back home. Big shoes to fill. Obviously, Mark has been doing this for a long period of time. Highly respect it. He has given me nothing but time to pick his brain, which I appreciate. And I get him for a few more weeks. And as he assured me, I have his personal cell phone, so we'll be talking so that that continuity continues on. I look forward to just, hearing the concerns, how we can move it forward, reconnecting with both the fire and police chiefs and the sheriff. So all that networking and, because this is an important job, what South Sound 911 does. If I was dating myself, I was on the committees that were making this a PSAP going from Lisa. So that's here I am looking at what the outcome was, which it was great to see. So I feel like I truly am coming back home. I look forward to speaking with all of you, both on and off the record, and let me know if you have any questions that I can answer, or I may be asking you. So thank you for your time. Appreciate it.
Thank you, Mark, and welcome home, Kat.
Before we start the budget, how about if we take 5 minutes? 5
Recess?
minutes. So 10:25, we'll be back in here. 4 minutes.
Okay.
So. Moves on.
Okay.
Nobody listens to me. I come here just to try and make people listen to me. Okay. How long do you guys want to stay here? Yeah.
That's the right question.
Okay. Okay. Let's go.
All right, we're back on the record. It's 10:26. Thanks for the brief recess. The next portion of our budget, pardon me, the meeting is about budget, and Janet and I will be presenting on that. There are fundamentally two key issues that have been decided. One sort of stemmed from Executive Mello's request to look at our projected revenues and perhaps bring them a little closer to the county model. Janet has gone through that exercise. She met with the Finance Committee and ran that by. The Finance Committee recommended not to go all the way as far as the county goes, but kind of pick a middle of the road. So that's one of the key issues you'll see underline things. And then the next big issue that you must decide for yourselves is how much to reduce your bills. That's fundamentally what it is. When we say cost allocation reduction or cost assessment reduction, that's just a fancy way of saying how much do you want to reduce your bills? And there's two options that Janet's going to present at a $3 million reduction or a 3.5. Now, a little issue that we have sussed out, yes, I used a young person word, with Chief McGrady is that, and we've made this point before, but the smoothing factors, which are really a valve to prevent volatility in the size of the bills, are set at 4 and 7 right now. So just imagine that as a valve. That valve prevents you from getting the full benefit of 3 million or 3.5 million in some cases, because only so much money can go through that 4% and 7% smoothing valve. Meaning we can't give you any more than 7% or decrease your bill by more than 4% because we have some arbitrary limitations in the place. There's nothing sacred about 4 and 7%. They were set up arbitrarily way back when, prospectively, and so they can be adjusted. Do not feel bad about adjusting them, at least in a temporary sense. Janet has widened the valve to 10 and 15% so that all the dollars flow through and benefit the partner agencies if you want to reduce your bills. So that's the kind of concept that's underlying some of this stuff. That sounds more complicated than it is. Just let us open the valve so we can benefit you with the cost reductions. Janet. You have 3 minutes. 3 minutes.
And 2.5 is already gone.
I will try to be very brief. There are quite a few slides, but most of them are just a lot of numbers. So we'll go fairly quickly through those, but I'll point out the highlights on each of those. And so first, we just want to talk about some of the adjustments, which the executive director has already alluded to. So one is a change in our projection for the emergency communication sales tax. We also increased personnel benefits by $35,000 due to an error that we noticed after the study session occurred last month. We also have a very minor change in the net motion allocation for the agencies that utilize that service. And that was just to Buckley Fire opting out. So they were removed and it raised everybody's cost by like $1. The FTE count, when we had the study session, we presented a proposed addition of 1 FTE to move our total to 272. We're bringing that down to 271, although we have left some contingency funding in there in case an additional FTE is necessary. And then as Executive Director already talked about, we have 2 proposals. Option 1 is a $3 million offset to our allocations, and option 2 is a $3.5 billion allocation. And just quick budget highlights from our meeting last month. Overall, our budget is increasing on the operating side by about 5%. We have factored in a 12.5% increase for medical premiums. We have provided the funding through our old reimbursement policy for emergency alerting for several of our agencies in the amount of $135,000. And we also heard from TFD about a new system they need for alerting and communications, and that is included in the budget as well for $42,000. We continue to provide the resources necessary to pay the PSCC bonds. That's $4.1 million each year. And we also have included an executive director contingency per our financial policies. That's 1.5 million, which represents about 2% of our operating expenditures. And then capital projects that we have planned in 2027, the RMS should be completed next year. That is fully funded, as well as the 911 call handling equipment or our phone system. That is also fully funded. It is year one of a 2-year project for replacing our logging recorder. So we have $800,000 allocated for that. We have CAD replacement beginning also in 2027. So we have $3.4 million allocated for that component. Very big project. We don't know the total cost of that one yet. We also have some facility upgrades budgeted for 1.15 million and network infrastructure for 1.3 million. Just a quick highlight of the budget. And then this next slide talks about the adjustment to the emergency communications sales tax, which represents about 43% of our total revenues. So what we originally proposed was 24.4 million in this revenue source. So the finance committee met in early August and agreed that we could adjust that by 2 million. So we're adding 2 million to that budget, to that budgeted revenue source. So obviously that is going to free up some additional money in order to provide that offset that we talked about. Just for to talk about the Pierce County projection, they have a much more aggressive approach. So it was 27.9 million. That's an 8% increase from 2025 and a 6% increase from 2026. So ultimately the finance committee recommended staying with a more conservative approach. Any questions on that piece? Okay. And then here's our 2 options. I'm just going to call out, there's on the first bullet in the second option, it should say 3.5 million and not 3 million. So, but we have option 1 with the $3 million offset, option 2 with the $3.5 million option. Both of these, as Kevin talked about earlier, have the increased smoothing factors. So no agency will increase on their communications assessment only, will increase more than 15%, and no agency will go down more than 10%. So on the next few slides, we'll take a look at how that affects each of the different disciplines that we have.
Mr. Chair.
Yes,
Sure.
Mr. Branstad.
I thought I heard you say that option 1 had a 3 million offset
Yes.
and option 2 had a 3.5, but the slide says 3 million on both.
Yes, and I did call out that error. So yes, I did make an error there. I apologize about that. I didn't see it until
But
that
the rest
point,
of the
so-
numbers in option 2 reflect the 3.5.
Yes, they're reflective. So if you look at the overall communications assessments for LE, it's 14.2 million with option 1, it goes down to 14 million with option 2. On the fire, it's 3.9, and then it goes down to 3.8. Okay. And so this slide, this is what was presented last month as well. I'm just going to highlight the bolded pieces. The offset, the portion of the offset for fire equates to 685,000, and that results in an overall increase for the agencies of 3.4%. So I will also call out the smoothing column on this chart. So with that widening, we don't have any smoothing. So we don't have any agencies increasing more than 15%, and no agencies that are districts that are going down by more than 10%. And then with 3.5, the offset increases to 799,000. That's an overall decrease of 6.3. And now we have just 2 of our smaller districts that hit just very slightly above that 10% cap. So that's why you see those small amount of smoothing dollars there. Make sense? On the loss side, we have a different story. So as we talked about at the study session, we have a history of offsetting a number of our smaller agencies. So they have been paying less than what they owed, and that they've been getting farther and farther behind for the last several years. So on this slide, the total offset for LE is 2.3 million, which is a overall decrease of 7.8%. But when you look at the smoothing column here, you're going to see a number of agencies that have exceeded that 10% reduction or exceeded the 15% increase. And so that's why you see a number of smoothing pieces there. And then when we increase that to 3.5 million, then almost every one of our law enforcement agencies are being adjusted by that smoothing factor. And then the last two slides I have is just a combination of the law assessments, both on the communication side and the support services side. So support services is actually going down by 11.6%. So I just wanted to provide this information because the overall change for law enforcement for some of those agencies that are getting 15% on increases on the comm side, they're also getting decreases on the support services side. So the overall change is coming down slightly in each of those. And that's option 1. And then option 2 with the 3.5 million. And then finally, this is an exhibit that is in the budget resolution itself. I'm just going to point to the very last line. So it's based on all of the changes. This is option 1 with the 3.1 million. We have over 12 million combined in our general fund and our strategic reserve. So those are monies that have not been allocated for any other purpose. We've maintained the capital reserve ending fund balance at 7.3 million, which was what was presented last month, and our 911 program office at 1.9 million. So a very healthy ending fund balance for the agency. And then when we look at option 2, the only change here is just it decreasing by about $300,000. Reason it's not the entire 500,000 is because of the smoothing. And that's all I have this morning. So.
Mr. Chair,
Yes,
just
sir.
a couple comments. So the board is being presented with the proposed budget for adoption, but there is a key decision to make. It's option 1 or option 2, which is option 1, reduce your bill by 3 million, or option 2, reduce your bill by 3.5 million. And when that flows out, you can see the work that Janet's done on that. So that's the fundamental policy decision that we're asking you to make. And then the second thing we're asking you to do is adopt a budget for 2027.
So at this time, Mr. Mello.
Thank you, Vice Chair Gilligan. First, thank you for hearing the requests for options and consideration at the July board retreat. It's clear that you've taken the discussion very seriously. You did a lot of work to come back with options. So thank you for the good staff work. Other than a different ending fund balance between the two options, which has a direct relationship to the revenue coming in, the cost allocation to agencies, and on the expense side, what the ending fund balance is. What is the other difference that we should be considering when determining both the cost allocation options and which budget to approve, the corresponding budget to approve? What is the difference to callers, to constituents, to our first responders, to the people we serve? What's the difference other than the ending fund balance?
Well, I wouldn't necessarily relate it to the callers and to what we provide. That's all included in the budget. Really, the fund balance is, as you know, in working with your own budgets, it's a reservation of money for future use.
Is that the only difference at the end of the day?
Yes.
Thank you. Didn't mean to interrupt you.
No.
With that in mind, if that is the difference, the only real substantive difference, I'm inclined to support option 2, the lower cost allocation to our agencies and the corresponding budget that is in alignment with option 2.
Any further questions, comments? Mr. Branstetter?
Mr. Chair, only a procedural question. The resolution in the packet merely says in section 1, Exhibit A, and in section 2, Exhibit B. So after we move that to adoption, we'll then need to amend it to say either option 1 or option 2 in those two sections to be able to go and do that. Is that the procedure you're
Yeah,
looking
I
to
think-
do as opposed to making
Yeah.
a change to what's in the agenda?
Yeah, by looking at the request for the board's action, both option 1 and 2 are there, and whichever one we pick will be the one that will reflect this resolution, correct?
Correct, Chair. So in response though to the question, I would suggest that the board move to approve the adoption of the 2027 budget for South Sound 911 Public Authority and choose option 1 or option 2 in your motion. And then we would separately pass the resolution afterwards, just so that it's really clean and we can track it. So if a board member makes that motion, just add option 1 or option 2 in your moving motion for the budget.
Any further comments from any of the board members? Would there be, Mr. Bushnell?
Thank you, Vice Chair. Just wanted to quick clarification. Our current reserve balances are within adequate. I know we had like a reserve policy and those are adequately funded. So I just wanted to confirm.
Yeah,
that.
so the general fund, we shoot for 15% in our financial policies. We're a little under the 15%, but we do have some availability within the strategic reserve that. So those two combined, we do meet that threshold.
Okay, thank you.
Yeah.
That solidifies my choice here as well. So thank you.
With that said, I think I was leaning towards option 1, just because I'm a little bit conservative on that number. And that's always my concern, is at the end of the day, once we spend that money is not going to be there if we have another special project that comes up. It's hard to argue against Executive Mello on what we're talking about at the bottom line and the amount of money. Our reserves are fine. This is not going to hurt us. It's not going to make us sweat at night, I don't think, going from 3 to 3.5. So with that, Mr. Mello, do you have something you'd like to move?
Trying to remember what our council was advising. Is the first motion to approve the option 2 cost allocation model?
If that is your choice, board member option 2, the motion would be move to approve resolution 2026-10, adopting the 2027 budget for South Sound 911 Public Authority option 2.
So moved.
Second.
Yes.
So moved.
That's your move?
And second.
Moved and seconded. I appreciate, the discussion was well, the meeting we had in July, what we have now, as I said, I was pushing towards 3, but the board is comfortable with 3.5 million. With that, any further discussions? Seeing none, all in favor, say aye.
Aye.
Aye. All opposed? Motion passes. Now, correct. So option 2 will be the word of the day in the resolution. I don't see any further discussion, so we're moving off a budget, and then we'll move to the resolution. Is that what we're at? I don't want to do another motion. I'm the chair. I'm the chair.
Thank you.
Okay. So so we have another motion that you'd like to see us take and move that we approve 2026-10, adopting the 2027 budget for South Sound 911 with option 2. I thought that's what we just did. Well, I'm glad that you would prefer it. So that is the motion. Is there a second?
Second.
Moved and seconded. All in favor of the motion, say aye.
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 All opposed, motion passes. With that said, now do we go on to the resolutions? Okay, so Executive Director?
All right, so let me just check. In the agenda, are we on to item number 2 under action items? Okay. So that item is a motion to upgrade the Avaya telephone system at South Sound 911. The Avaya is what we might call a landline or desktop style classic phone system. I've been told emphatically that the Avaya telephone system is actually part of the emergency communication system here. We could do away with it in theory and not have administrative calls, but it actually serves as a backup to our call handling equipment. So if our call handling equipment fails, we would actually resort to the old method of taking calls across desktop landline phones and using a notepad to write down calls and then dispatch based on that. That's the way it occurred in the old days. So the Avaya system is still part of our emergency communication system. What's happening is, as you would expect, the current Avaya system is based on the 8th generation of firmware. They're skipping the 9th generation and moving to the 10th generation. So fundamentally, we're asking you to approve the authorization for us to get the new 10th generation or 10th firmware system. That cost is about $460,000 and will be implemented over time.
Thank you. Anything further?
Anything further? Nick's here for questions, if anybody has questions. And Nick, by the way, assures me that the Avaya system is also used by the Department of Defense in the Pentagon. So there you go.
With that said, seeing no, Mr. Bushnell.
Oh, I was good. Yep. Move to approve 2026-23.
Second.
Moved and seconded. Further comments? Seeing none, all in favor say aye.
Aye.
All opposed? Motion passes. With that, any other further business?
Thank you.
Yes.
I will
Yes.
be quick. Sure. Thank you. I've mentioned this before, and I'm going to be loud because I'm talking to some of the folks back there. But we are 1 month away from Pierce County Suicide Prevention Summit and 5K. There are 3 segments to this. You can register for one or all of them. The first one is really targeted at our law enforcement, our fire agencies, our EMS, as well as healthcare providers, the professionals and providers that are really helping folks that are dealing with suicide. And of course, these professions have really high rates of suicide as well. So that's the earliest portion between 12 and 4:30. One of our main speakers, as well as our keynote, is coming to us from Snohomish Sheriff Office. She's a TED Talk speaker. She's amazing. She's going to be speaking to the audience here. So we really hope that all of our agencies will send representation. Councilmember Herrera and I are co-hosting this. We will be calling agencies next week if we don't see somebody from your agencies. Please don't make us do that. We would really like to see somebody from all of your agencies, because this is an issue that we're dealing with throughout Pierce County. The second section from 4 to 6 is for the whole community. Everybody's welcome. There's going to be trainings to identify folks that are in crisis, how to listen, how to help, as well as support groups for people who have been impacted by suicide. So really everybody. And then finally, we're having a massive 5K walk and run across the Tacoma Narrows Bridge and back. All of this is free. The runners or walkers are going to receive a really cool badge. I mean, this is going to be a huge, wonderful event that we hope will save lives. Please, please, please help us get the word out about this. We're really just like running ourselves ragged, trying to make sure that we don't hear after this event, I wish I would have known. So talk to your families, your friends. We've got flyers, anything I can do to help you get the word out, because we're so appreciative of your partnership on this. And we're only a couple weeks away, so we could use your help. Thank you, Chair.
Councilmember Denson, South Sound 911 will participate, at least as far as I'm able to commit, and I'll try and round up some other folks as well. I think this is a super good event, and most of you probably don't know, but Councilmember Denson rounded me up months ago to go update the suicide prevention signs on the Narrows bridge, and that really brings it home when you're updating the signs out there and you're looking down, realizing that people contemplate the end of their lives by jumping off those bridges. So it's symbolically important, and it's important because it's really happening. So thank you, Councilmember Denson.
Thank you.
Anything else, Mr. Executive Director? Yes, Board Member Hubler.
He's like, I got this. Can you send us the flyer digitally
Yes.
so we can post it on social
Yes,
media?
I will
and
send
stuff?
it to the whole board, and anybody else who wants it, just please reach out. Thank you, Carrie.
Anything further? Seeing none, next meeting, September 16th, 2026. Chair Rumbaugh should be back and be a little bit quieter meeting. With that said, is there a motion to adjourn?
Move to adjourn.
Moved and seconded. All in favor, say aye.
Aye.
All opposed may stay around as long as they'd like. Oh. Thank you very much. It's good. Thank you.